Life a Doctor. Today we're going to be talking about psoriatic arthritis. If you know someone that has psoriasis and you're curious about what psoriatic arthritis is, stick with me and we'll break it down. You may have heard of psoriasis. And psoriasis is an autoimmune disease where the body decides that it doesn't like itself anymore and it starts attacking the healthy tissue of the body. A lot of the times we hear it when it refers to skin, and that's because the skin starts to produce super amounts of skin and you have the silvery plaques and patches all over the body. But what concerns the foot and ankle doctor is not only the skin issues, because of course we have skin on our feet, but it's also how it affects the bones and the joint. And that's where we start to discuss psoriatic arthritis. It usually affects patients that are within the ages of 30 and 50. A lot of the time it affects the large joints like the sacroiliac joint, lumbar joints, and things like that. But we do see manifestations in the foot and ankle, and that's where your podiatrist comes into play because they see the foot and ankle every day. Now, what causes this? Again, like I had mentioned earlier, it's an autoimmune disease, and autoimmune diseases are poorly understood, but we just know that sometimes the body's immune system just goes a little haywire and decides to attack normal, healthy tissues in the body. And so like I said here, it affects the skin and other tissues like the bone and the joint. Now, what are some of the symptoms that you will get or you may think to have that will make you think that you may have psoriasis? Let's break it down. Some of the symptoms of psoriatic arthritis includes joint pain and stiffness. But one of the hallmark signs that makes you differentiated from all the other arthritis is a lot of the times it's asymmetric. And also, it usually runs in families. So you can ask your mom, your aunt, your dad, or anybody in your family, and they may also have psoriatic arthritis or psoriasis. Cue Kim Kardashian, how she said she had psoriasis and she got it from her mom. So that is a nice social example of how it runs in the family. A lot of times, like I said, it's asymmetric. You have joint stiffness and joint pain and joint swelling. Other than that, honestly, it is really hard to tell and differentiate between psoriatic arthritis and all of the other arthritis that we have out there. Now, to be more specific, in the foot and ankle, what are some of the symptoms that you may see? You may see something called dactylitis, and that's when you have sausage fingers and toes. They're thick, they're big, they're swollen, and that's because of the inflammation that you would get in the foot and ankle joints. Of course, you see the dry, scaly, silver plaque. It's usually everywhere in the body. It doesn't pick and choose, but you may see some of it that may occur in the foot as well. Another symptoms that some patients may have is enthesitis. Now that is just a fancy word for saying inflammation in the areas where the tendons or the ligaments attach to the bone. Notably, where the Achilles tendon attaches to the heel, where the plantar fascia attaches to the heel, or anywhere where the ligaments attaches to the body. So, a lot of the time patients will have plantar fasciitis, which is inflammation of the plantar fascia, or Achilles tendonitis. Again, inflammation of where the Achilles tendon attaches to the calcaneal bone. And we may wonder, why is this happening? Is it because they're not stretching enough and all of these other stuff? But it could just be the psoriatic arthritis that is acting up and causing inflammation in these sites. Some other vague symptoms, not quite as specific to psoriasis, but still presents, are lower back pain. Some blurred visions may also occur, and also stomach problems like bloating and diarrhea. Again, these are not specific to psoriasis or psoriatic arthritis, but these are some of the symptoms that some of the patients who do have this have complained about. Now, the unfortunate thing is that there is no cure for psoriatic arthritis or psoriasis. However, thankfully, with modern medicines, there are medications that can help manage the symptoms and prevent further damage of all the organs that psoriasis affects. If you do have psoriasis, I'm sure you've seen your doctor already and they have prescribed some medications. But if you're not sure, a lot of the time some over-the-counter anti-inflammatory medications may be of great help. Make sure that you check with your primary care provider that any over-the-counter medications that you are taking is not going to affect any of the medicines that you are already on. Wearing supportive shoes will be paramount to help you provide comfort and help you walk faster and further and live your healthy, normal life. Now, when you have tried some over-the-counter stuff and tried to manage it as much as possible, you're still not getting relief, you're still getting pain, and you're still uncomfortable and not living the best life that you know you're supposed to be living, that's the best time that you have to see a doctor. A doctor will prescribe medications that includes biologics, DMARDs, NSAIDs, and things like that. There are also steroids that could work, some aqua therapy, physical and occupational therapy. There are lots of things out there, but see your specific doctor in your area to help you get this feeling better. If you're in the Houston area and you would like to see us to help take care of your issues, you can give us a call, 832-415-1790, or visit us on our website. We can also have virtual appointments. But remember, psoriasis is something that has to be managed. It does pass on from generation to generation. It's an autoimmune disease that has no cure, unfortunately. But with modern science and modern medicine, we can manage it and help you live a long, happy, healthy, fulfilling life. If you have any questions, leave them down in the comment below. What was the most shocking thing that you found out about psoriasis today that you didn't know about? I'd love you to share with me. Now, if you have friends and family who you think may have this issue, would you mind sharing this video with them? I don't only want to help you, I want to help your friends, I want to help your family members, I want to help everybody that could be watching this video and benefit from it. If you have any specific questions about it, also leave us a message down below, or you can follow me on my other platforms, The Fly Foot Doctor on Instagram as well as on TikTok.